Hello, Dr. Wohlgenannt. Thank you for being here with us today. Can you tell me about your background and the focus in your practice?
Yes, my focus is neurology. I'm a neurologist and I work in the Rehabilitation Center in Meidling, and we are specialized in TBI rehabilitation. We are from the AUVA, from the Austrian Compensation Board, Workers' Compensation Board. Yes.
And what motivated you to be a part of this program?
I think it's very interesting to share our experience with other countries, and it's like my colleague mentioned, unique to share experience from the acute setting to the rehabilitation. To this unbroken chain, this is important. This unbroken chain from the beginning till the rehabilitation, and I want to be a part of this.
Do you know any other similar programs?
It's my first. It's my first, and yes, and this year I participate the first time. Yes.
Which do you think are the main challenges when it comes to neurotrauma approach, treatment?
Collaboration between the trauma hospital and the rehabilitation center. It should be very close, and this is in Austria. It's a challenge. We are on the right way, I think, but this is most of the challenges we have.
Can you tell me about one of the most interesting cases you've ever encountered?
It's difficult to answer because our cases are interesting, always interesting. So
something that stood up, maybe that you remember.
I like to observe patients when they admit to our hospital, to the trauma hospital, because we are connected with a corridor. And when you see the patient first, and then we transfer them to our rehabilitation center to observe how they become better. It's always an interesting thing for me. Yes.
When it comes to medical practice, which do you think are some gaps or problems that should be solved with priority?
The medical gap.
Maybe, as you said, about the collaboration.
Yes, this is, we have, you will see it in our rehabilitation center. We have two parts of patients, two groups of patients, occupational accidents and non-occupational accidents. And we have the advantage to start with rehabilitation as early as possible, especially for our occupational accidents. But if there's non-occupational, for example, after leisure accidents or sport traumas, sometimes it needs time that you can start with the rehabilitation, and then this is the big problem. I think this is the main problem, because I think to start as early as possible is so important for them, because they have a better functional outcome before they stay shorter than the other patients. Yes.
And when it comes to the development of new guidelines, for example, the AMN network is working on a guideline together with other societies. Which do you think should be addressed? Like some topics that you think should be addressed in those guidelines?
It's important. Neurorehabilitation, it's the guidelines, how to deal with it. I think
the main topic.
It's the main topic. I'm a neurologist, and so it's the very important topic. Yeah.
That's it. Thank you so much for your time.
Thank you.
We hope you enjoy the rest of the presentations.
Yeah, thanks.
Thanks.
Bye.